Physical inactivity is one of the main factors driving non-communicable diseases such as obesity. Yes, obesity is a disease, which then increases the risk of numerous other health complications.
The World Health Organization and the World Obesity Federation noted that not only obesity is a chronic but also a complex disease. Nevertheless, don't worry, there are solutions. Hi, I'm Dr. Nisa Nabila and you're watching My Body, My Life.
Obesity rates worldwide have more than tripled between 1975 and 2022. At present, nearly 2.3 billion children and adults are overweight and living with obesity. This ongoing increase is deeply troubling, placing obesity among the most critical global health concerns. The 2023 National Health Screening Initiative revealed that over 50% of Malaysians tested face overweight or obesity issues. Obesity is not just a cosmetic problem. It is a health condition that can lead to a wide range of illnesses, including heart disease, diabetes, high blood pressure, high cholesterol, sleep apnea, and cancer.
Obesity is defined as a medical illness. It's actually a group of diseases that risk your life. And when the amount of weight exceeded the capacity of your organ to withstand and take it over.
Actually, globally, it is a big issue, obesity, especially in countries like in the US and also in our part of the world, where I think more than 50%, 54% of people are actually obese in this world.
We are actually a champion in this field. About 54.5% of women and 45% of men in Malaysia are actually considered obese and overweight. And not only obesity for adults, we are talking about childhood obesity as well. Also is considered one of the very high number, I would say top 1 or top 3 in the obesity for adults and even for childhood as well.
Obesity is defined as an abnormal or excessive accumulation of body fat that can harm one's health.
But what determines obesity? Obesity is determined by BMI, or also known as body mass index. Body mass index can classify a person into underweight, healthy weight, overweight, and obese.
It's a formula we use to see the physical condition of the patient. So the way we calculate is patient's body weight in kilogram divided by the height of the person by the power of 2. Now that BMI, from the BMI you classify people from normal weight, overweight, then you have the 3 classes of obesity, class 1, class 2, class 3. Then we go for a different category, those are super obese people who have a BMI more than 50. Then they have another 3 categories: super obese 1, super obese, and ultra super obese. These are the main.
Teen and children actually are growing, right? So you still can use the BMI, but it may not be as accurate because they are constantly changing their body. But once we are adult, we stop growing. So it's a little bit different when you measure for teen and adults.
BMI, Body Mass Index, is widely used to assess whether a person's weight is suitable for their height. The calculation is simple: weight in kilograms divided by height in meters squared. The resulting BMI is classified into 4 categories. A BMI of 18.5 or below indicates underweight. A BMI between 18.5 and 22.9 indicates a healthy weight. A BMI between 23 and 27.4 indicates overweight. A BMI of 27.5 and above indicates obesity. In general, there are 3 levels of obesity that guide appropriate weight reduction approaches. BMI 27.5 to 32.4 is Class 1 obesity. BMI 32.5 to 37.4 is Class 2 obesity. BMI 37.5 and above is Class 3 obesity or morbid obesity. For children and adolescents, BMI calculations differ from those of adults. This takes into account age and gender factors as their growth patterns vary.
We can't apply BMI on pregnant lady as well because they are pregnant. They have 2 live there, the baby is there, so I just can't apply on them.
Elderly people and athletes, sometimes athletes, they're actually building a lot of muscle. So they may not be obese, but BMI be a bit high because of muscle bulk. Same goes for elderly. They may not be obese, but they have a lot of muscle wasting. So it is a little bit different. So it may not be so accurate when you come to the BMI for this group of people.
We don't have a lot of weight, but when the weight is all the fat distributed in the abdominal part, which we call it abdominal obesity, or we call it central obesity, these type of people, they will have more problems. Diabetes, hypertension. For females, they have all this infertility problem. And there is, they call it something we call WHR, waist-hip ratio. So anybody like for female, between 0.7 to 0.79, that's considered okay. For male, anything below than 0.9, that's also considered okay.
BMI pertama kali waktu umur saya dalam, bila kita dah nampak naik sikit tu, dalam awal-awal 30-an lah, tu baru rasa macam dah macam dah berat sikit lah. Tu yang start saya buat tu pertama kali. Doktor kata, Puan, you punya weight ni sekarang ni dah border, so kita tak boleh nak proceed dekat normal ward yang biasa. Tu yang start trigger saya, yang rasa macam oh, saya kena buat sesuatu.
Many factors, both direct and indirect, can contribute to obesity. These factors are generally similar for most people, though some differences may occur depending on age. High-fat foods and foods high in sugar are among the main causes of obesity. In addition to diet, genetic factors, physical activity, certain medications, mental health disorders, and environmental conditions can also lead to obesity.
I think the biggest risk factor is eating habits, right? So a lot of us have different kinds of eating habits. So the unhealthy ones tend to snack a lot. So I think snacking is not a really good thing to do. And then the other factors will be genetic. Okay, you may have parents or family who are obese, and definitely genetic factors come into that.
Nowadays, cars, we tend to drive, we take escalator, we hardly climb stairs. That also limit our physical activities again, increase our calorie intake, and then we become more obese. Some people even blame the technology of invention of light. You know, the factory running 24 hours, people work non-stop, we can receive WhatsApp 24/7. People tend to work, then people tend to stay awake. So this give rise to actually change your hormone in your body, and this are actually also a main cause of obesity as well.
There are many factors that can lead to obesity, and one of the most significant is an unhealthy diet high in calories or sugar, such as fast foods, soft drinks, or alcohol. Studies indicate that genetic factors can influence the amount, distribution, and location of fat stored in the body. Genes inherited from one's parents may affect how efficiently the body converts food into energy, regulates appetite, and burns calories during physical activity. A sedentary lifestyle also contributes to obesity, since consuming large amounts of calories without burning them off through physical activity leads to weight gain. Lack of sleep can increase the hormone ghrelin, which stimulates hunger, and decrease the hormone leptin, which signals fullness. These hormonal changes are yet another cause of obesity.
Causes like disability, some people unfortunately they have certain handicap, they can't move so much, that limits their physical activity, they have no chance to burn their calories. Stress, we can always blame stress, our workload, the way we work nowadays, the expectation from the superior, that increase our cortisol level, that will also, we can also blame that.
Certain medications like steroids, there are people who take a lot of steroids. This causes change in body habitus and they can become obese. Another factor, it could be patients who have certain medical conditions like diabetics, or in women there's this condition called polycystic ovarian disease, who also develop these kind of conditions and end up with obesity. So there's a big group of causes for patients who are prone to be obese.
As people age and their physical abilities decline, their metabolism often slows down and they may become more sedentary. Both of these factors increase the risk of obesity. Individuals experiencing stress or emotional distress may seek comfort by overeating, which can lead to weight gain. Scientists have long identified a correlation between stress hormones and increasing body weight. Certain medications including steroids, antidepressants, anti-epileptic drugs, and diabetes treatments can also contribute to obesity. Weight gain can also occur as a side effect of conditions like metabolic syndrome or insulin resistance, as well as polycystic ovary syndrome, PCOS, a hormonal disorder that can cause infertility in women.
Mental health and obesity, it's come to the terms what we call bidirectional relationship, meaning to say people with obesity carry high risk to develop mental health disorders such as anxiety and depression because of, there's something that known to be beauty privilege, and then people started to internalize a sense of stigma. Oh, I am obese, I'm not pretty, so I might lose a lot of benefits in the society. So hence this developed a negative self-value, and then they started to feeling helpless and hopeless, and all this like a vicious cycle can contribute to anxiety and depression. So not to forget, when we talk about mental health disorder, it's also involved eating disorder, meaning to say those who have underlying bulimia nervosa or anorexia nervosa, usually they do have history of being obese or overweight and during their younger life.
Many individuals with obesity often grapple with emotional turmoil, low self-esteem, body image dissatisfaction, and a reduced quality of life. All of these factors can unknowingly impact their mental health. Mental health and obesity are closely intertwined. For example, individuals who are depressed are more likely to develop obesity, while those who are obese are also at higher risk of experiencing depression. Scientific research suggests that between 20 and 60% of people with obesity suffer from psychiatric disorders. Beyond depression, mood disorders, schizophrenia, ADHD and trauma are among the mental health conditions that can affect individuals with obesity.
So far, Alhamdulillah untuk saya tak ada kacau mental lagi. Mungkin sebab saya keep on stay positif walaupun dalam keadaan kita macam ni. Kita punya lifestyle, saya punya lifestyle tu agak berbeza sikit sebab mungkin salah satunya sebab faktor kerja. Saya bekerja dengan ikut shift. Jadi bila kita kerja shift ni, waktu makan kita pun dah tak menentu. Lepas tu kita tak ada exercise sebagainya kan. Yang itu yang buat dia cenderung untuk naik lah.
Obesity is not just weight related, it's a much more serious condition. It raises the risk of having kidney problems, heart disease, and even cancer. It weakens your bone and it also affects your reproductive system.
Obesity has a lot of impact on one's health negatively, unfortunately. If we look from head to toe, the problem is everywhere.
Basically, because you are make the body acting against itself, and you are keep resisting this till the body will give up and get tired, and the illness is going to go. If you want to name any organ that can be involved, all the organs can be involved.
When you have obesity, that's why I said it's called a metabolic syndrome. So it affects the endocrine function of our body. So you develop things like diabetes, and then you have fat accumulation in your blood vessels. So that affects your heart. So you can end up with heart disease, heart attacks, and there's genetic change when you eat unhealthy food because of obesity. So when there's this genetic change, then you are prone for cancers. It affects many different organs in your body and different genetic changes. So that's why people are prone to get this kind of health conditions.
Obese individuals face a higher risk of developing serious diseases or health complications. Obesity is a significant contributor to heart-related illnesses, which continue to be the leading cause of death in Malaysia. Excess weight forces the heart to work harder to pump blood throughout the body, increasing arterial pressure and raising the risk of high blood pressure. It also disrupts the body's ability to metabolize fats, leading to elevated LDL cholesterol levels that are harmful to health. Type 2 diabetes is especially common among obese individuals. Obesity doubles the risk of developing osteoarthritis, a joint disease affecting areas like the knees, hips, and lower back. Additionally, the higher the body weight, the greater the risk of gout, a condition linked to elevated uric acid levels in the blood. Respiratory issues are another complication of obesity, often resulting in conditions such as asthma and sleep apnea. Research has shown that excess body fat significantly raises the risk of certain cancers, including colorectal, breast, uterine, esophageal, kidney, and pancreatic cancers.
Don't let obesity slow you down. Eating healthy and staying active will help to reduce your health issue and manage your weight. In severe cases, treatment to lose weight can be from medication and surgery, but it depends on every individual needs. Most importantly, find your licensed doctors for the best approach.
The most important thing from our side as a dietitian is that we give everything scientific based with evidence. There is no one specific food that we recommend obesity patient, but I would like them to understand the concept of calories. No matter how, we don't encourage very aggressive weight loss process. Sometimes you stagnate there. So what we have to remember is that as long as there is progression, it's good enough already.
First thing, if people who have challenges to do activity, they don't have time, they don't have place, they must make a conscious effort. We want cardiovascular, we want muscle, and we want people to do as much activity in a day that can help them burn fat. If they can do these two on a regular basis, definitely they'll start seeing change. And once they start seeing change, they get motivated to continue on with their exercises.
Treating obesity with underlying mental health disorder, we will offer talking therapy, or we call it as psychotherapy, that bring good evidence for those who have underlying obesity, what we call cognitive behavioral therapy. So other than talking therapy, so we would encourage them to join support group, practice healthy lifestyles, healthy diet, and also we encourage them to practice relaxation therapy. We call it as mindfulness-based therapy, where we want them to focus on their healthy and mental well-being recovery journey.
The most effective way to treat and prevent obesity is by maintaining a healthy diet and engaging in regular physical activity. Individuals struggling with obesity are encouraged to seek advice and support from healthcare professionals to create personalized plans for nutrition and weight management. To achieve a healthy weight, follow these steps. Focus on eating a balanced and nutritious diet. Avoid sugary and calorie-dense foods and beverages. Incorporate regular physical activities such as running, jogging, or swimming into your routine. Reduce sedentary behaviors like gaming, extended computer use, excessive TV watching, or lying down for long periods. A healthy mindset is essential as it provides the motivation needed to make meaningful and sustainable lifestyle changes.
There are oral tablet forms and there are injection forms for medication. These drugs also do have some side effects. There are a variety of drugs, but generally what they do is they reduce your appetite and you feel full for a long time.
People, they understand actually bariatric is a weight loss surgery. It is not. It is a treatment for morbid obesity. Weight loss is just a bonus from that.
The risks of surgery is almost similar, but we compare the risk of long-term obesity is so much higher.
There are several medications that can help with weight loss. However, these medications must be taken under the supervision of a healthcare professional, as they may have side effects. For individuals whose body weight exceeds 100% of their ideal weight or have a BMI reading over 37.5, bariatric surgery may be recommended. This option is typically considered when other weight loss methods fail to produce effective results. Bariatric surgery is a procedure aimed at aiding weight loss. It works by altering the digestive system, either by reducing the size of the stomach or bypassing a portion of the small intestine.
Kita slowly turunkan berat dengan cara amalkan gaya hidup yang sihat lah. Mungkin slowly kita brisk walk balik dan saya buat intermittent fasting. Tapi selepas saya amalkan gaya hidup sihat, alhamdulillah lah ada perubahan yang orang kata sikit-sikit tu yang kita nampak perubahan dia compare daripada yang sebelum ni.
Obesity affects every aspect of life. From health to relationships, its impact is profound. This is why fostering awareness of a healthy lifestyle is so important. It begins with yourself and extends to your loved ones.
A healthy body nurtures a healthy mind. I'm Dr. Nisa Nabila, and thank you for watching My Body, My Life.